Chronic shoulder pain is extremely common in Jiu Jitsu athletes. What are some common possible diagnoses? First, I would like to note that if you're training and suffer an acute shoulder injury with severe pain and limitation of range of motion, it's important to be evaluated immediately to rule out a fracture or a dislocation. The shoulder joint is composed of three bones: the clavicle or the collarbone, the humerus or the arm bone, and the scapula or the wing bone. Several layers of muscle, and the skin. If you're suffering from shoulder pain, the first thing you should evaluate is your skin. Look at your skin in the neck area, shoulder area, arm area, and elbow area. Do you see anything there that could easily explain the pain, such as cuts, bruises, scrapes, lesions, boils? Anything on the skin that could explain the pain. After that, push on the muscle belly of the biceps. Push on the distal biceps tendon and the two proximal biceps tendons. Chronic biceps tendinosis is a very common cause of shoulder pain, as it can refer pain into the shoulder area. Next, evaluate your neck. Do you have a history of degenerative disc disease? Do you have a history of neck pain or neck injuries? A pinched nerve in your neck can easily refer pain into the shoulder and into the arm. Very common issues with the shoulders are, number one, rotator cuff syndrome. The rotator cuff is composed of four muscles, three on the back side of the wing bone and one on the front side. On the back side, we have the supraspinatus, infraspinatus, teres minor, and on the front side, the subscapularis. In Jiu-Jitsu athletes, very easily there can be a tear of one or more of these muscles or a tendinitis that could easily explain the pain. Usually there's pain with range of motion with a rotator cuff syndrome. Another common shoulder condition that can cause chronic pain is impingement syndrome. The supraspinatus tendon can become inflamed as it goes through the bones there, and you have difficulty raising the arms overhead, pain, decreased range of motion. Another common chronic shoulder issue is bursitis. The bursa are little fluid-filled sacs at various points throughout the shoulder joint. They can become inflamed and cause severe pain, many times when you're laying on that shoulder. Another common condition is an injury to the acromioclavicular ligament, which connects the collarbone to the wing bone. Usually in this condition, you will be tender right at the front of your shoulder where this AC joint comes together. Another injury that Jiu-Jitsu athletes suffer a little less commonly is a labral tear. The labrum is a coating of cartilage where the arm bone connects, and many times you can get a tear causing pain. So with shoulder pain, first evaluate the skin, then the biceps, think about your neck and pinched nerves there, and then think about rotator cuff syndrome, impingement syndrome, bursitis, an acromioclavicular injury, or a labral tear, and always see your doctor for a proper diagnosis.